Diabetes, Alzheimer's, cancer. They are diseases that eventually touch all of us. And that's the name of a revolutionary research program. UW-Madison is just one of 10 groups involved in the All of Us research program, an unprecedented effort that seeks answers for diseases for more than just a select few. Eric Franke reports.
I want to know why. Why are we having all of these things?
Few people know their family history like Annie Weatherby Flowers.
I can connect my white ancestry. I actually can connect to my great-great-great-great-grandparents who were mulatto, who came in the inter-passage in the United States in terms of the slave.
Serving as Community Engagement Director for Madison's Public Library.
And both of them are deceased.
Her knack for research led her to dig more deeply into health issues that have plagued her family.
We have lots of autoimmune diseases, and a lot of them are European American.
Annie herself has 4 such diseases. She's lost 2 siblings way too young, and her desire to learn more led her to help all of us.
In order to do that, you need a lot of people, and you need a lot of data, and so that's what All of Us is.
Dorothy Farrar Edwards is one of the co-principal investigators of the All of Us research program. UW-Madison is among just 10 research groups nationwide collecting health information, seeking 1 million volunteers in 5 years, and putting all of that data within the reach of scientists who will save lives.
That's why this initiative was funded by NIH, was to really take advantage of all the genomic tools that we have linked to health information and to move the field forward in cancer, heart disease, diabetes, Alzheimer's disease.
And she not only leads the study, like Annie, Dorothy enrolled in it, motivated by a search for answers triggered by the loss of her brother to heart disease at 43.
Why am I so much at risk? Why did my brother pass away when he was so young? What's the risk for my children? I mean, what do we need to do? I have 4 adult children now. So my interest is why is heart disease so prevalent, even in people who don't have the traditional risk factors? And that was my motivation.
Whatever the motivation, they need those volunteers to provide the database unlike one ever seen before. The process to enroll is simple.
We contact you. You can schedule your own appointment, or we'll contact you and come in for a really quick visit where we do height, weight, blood pressure. We draw some blood, ask you for some urine, and then ask you for consent to your electronic health records.
The hardest part was doing all of the paperwork, the registration, the answering all the questions and the surveys, and the data collection.
Data that includes segments of our country previously underrepresented in medical research.
In the past, we have not had good representation from racial and ethnic minorities or people with disabilities or rural individuals. So the goal of this is to create a representative sample so we can address healthcare issues across the entire population of the United States.
That's earned Annie's trust.
And my sister died from complications of Graves' disease.
Something she hopes will lead to some answers for the future.
And these are some of my grandkids.
Especially for her 2 sons and 9 grandchildren.
Just wanting to find out why, trying to connect that to the origin, and maybe look at preventing or doing some intervention for my grandbabies and future generations.
That was Eric Franke reporting. Another important reassurance that Annie got was that her information would be safe. The UW says the program has the same data breach protections as the National Security Agency. If you would like to learn more about the All of Us research project and how you can join, go to the website allofus.wisc.edu or call the number on your screen. Participants will receive $25.